MaShonna Hughes, the Chief Dignity Officer with Project Outpour here in the Charlotte-Mecklenburg area. MaShonna, thank you so much for your time.
Thank you for having me, Vanessa.
So we wanted to talk about some of the changes that your organization is experiencing as far as trends that we're seeing with the unhoused community, needs that are changing, as well as potential resources that are kind of up in the air, because we've been talking a lot about how so many different groups are kind of in a curious position with their funding based on some of the federal cuts that we're seeing. So MaShonna, just quickly run us through Project Outpour, first of all, for folks who might not be familiar with what y'all do.
Yeah, so Project Outpour provides free mobile shower and hygiene services to our neighbors who are moving through homelessness. We believe that the dignity that comes with being and feeling clean is a human right and a need that every person desires and deserves to have met. We have 5 locations that we go to each week and provide mobile showers and hygiene services to those in need.
So with what you do in the community, what are you seeing kind of there on the front lines as far as the unhoused community, the demand that you're seeing, any changes in that this year?
Yeah, unfortunately, we have seen a significant increase in the number of unhoused individuals in Mecklenburg County. Recent data indicated in November of last year, there were over 3,200 individuals who were experiencing homelessness. This includes young adults, families, the elder community, and that includes children as well. And we are continuing to see that number grow, specifically through our mobile showers. Last year, we provided 2,494 showers, and that was a 550 increase than what we had seen in the previous year in 2023. Because the current situation that we're facing financially around funding and the policy changes, we're anticipating to see that number increase for our mobile showers and hygiene services in 2025. And it really just puts a strain on the resources. We want to be able to continue to meet the demand and also expand our services outside of our 5 locations, but we're limited because of the current changes and just the unforeseen policy changes and funding sources that are being depleted or allocated elsewhere.
Are you able to kind of illustrate the percentage or the slice or the share, or maybe just how big of an impact this funding question mark, if you will, is having on what you're actually able to do on the ground?
Yeah, so being a nonprofit, we are supported heavily by grants and also individual contributions. And so primarily Project Outpour is funded through a lot of grants. And with current funding being scratched or again being reallocated to different areas, that really impacts the ability for us to not only operate, but to continue to serve our community. Right now, we are pretty grant heavy when it comes to the resources to be able to sustain our services. And so with the current pause on HUD funding, it really creates implications and just a true unknown of how we will be able to sustain and grow to continue to meet those needs.
For those folks who might not, think much about it because maybe they're blessed to have access to a shower whenever they want it. What does your service of providing the shower, what does that do for the folks you serve?
It's a plethora of areas that it addresses. First and foremost, it would be the dignity, the self-respect that every person has and should be treated as such. It also opens doors for better health outcomes, mental health, increase in mental health areas, job opportunities, housing opportunities. So one of the areas that we truly focus on outside of just showers and hygiene is really getting our neighbors connected to the resources that they need. And you can only imagine, no one wants to show up to a doctor's appointment or to a job interview when they've not had a shower or they're not clean or have clean clothes. And so that really creates a limitation for our neighbors to be able to pursue those goals and those desires that they have.
Are there any specific stories that kind of stick out to you, you know, of somebody you've served, or, you know, a story that I think maybe just would surprise folks who just don't have a full understanding of what the unhoused picture looks like in our area?
Yeah, so I had the lovely opportunity of serving one of our neighbors at our Beatty's Ford Library. Back in the summer, we connected and we really built a rapport. She continued to come to services week after week. And we again just built that rapport and that trust with one another. And through just casual conversation, she disclosed that she had been living with HIV. She was an elder woman. And so because of her lack of resources, lack of access to hygiene and housing, she was very limited in the medical care that she could receive. Again, not because it wasn't present, but the access. Who wants to, again, show up to a doctor's appointment when they're not feeling their best or they're not presenting in a way that reflects who they truly are? And I'm so grateful that we were able to create the bond because I had just attended a training that had provided some information and insight indicating that there had been some recent funding to support our neighbors who were unhoused with who were living with HIV. And so we were able to connect her to those resources immediately. And I am so happy to say that she has been housed. We stay in constant communication. I provide her with support that she may need outside of just the housing stability, but additional resources. And so again, those are one of those true areas that our showers were the gateway to be able to extend and provide additional resources and access to our neighbors who are moving through homelessness.
It sounds like y'all have a truck situation that's going on right now. So you have a truck that you use to kind of bring these services on site to folks. And I think your truck is dying, is from what I hear.
Yes, it is. It has served us well, but also on its last leg. We are quickly approaching 85,000 miles on a 2014 Dodge truck, which hauls our mobile showers. In order for us to, again, be able to sustain and maintain our services, we really need the support from our community to help us combat this ongoing issue. And so we're currently in the search of a new pickup truck to haul our mobile showers to our current locations and with the goal of being able to expand to additional locations here in Charlotte.
So how can folks help out if they'd like to?
Yes, so we have a current a campaign going on right now at projectoutpour.org. You click the donate button, it will give you the option to support our truck campaign called The Road to Dignity. And it would be a great opportunity again to just help us continue to serve our neighbors moving through homelessness through our showers and hygiene.
Would you say to folks, you know, if you could leave them with, you know, a final message of why they should help out, why should they care about this issue? What would you tell people watching this right now?
I think the biggest takeaway for me personally has been we are all struggling, battling, or will have those things in our lifetime. And I know for me personally, a shower is the one thing that I run to release, to think, to process. It helps me in so many ways outside of just hygiene. And to be able to provide and extend this necessity of a resource to our neighbors is an area that I wish more people truly understood and saw the value in outside of their current situation. At the end of the day, these are human beings. Society sees our neighbors, unfortunately, as the least, the left out, and the lonely, but the stories that we hear, the relationships that we build with our neighbors, it's such a rewarding opportunity to learn who they are beyond their current circumstance and beyond their current situation. And to be able to combat this community issue, we really need the community support to continue addressing this so that we can meet the needs of our community.
Or anything that kind of keeps you up at night the most when it comes to the, you know, the current situation at hand, whether it is the state of, you know, the unhoused community here in our area, or funding, whatever it is? What are you thinking about most right now?
It right now it's always funding. We have a very small but mighty team of 4 individuals. I'm the only full-time staff, and I have 3 part-time staff who support the shower operations. But in order for us to continue to address and combat this growing need, we need the support of our community. And that heavily relies on funding, whether that's through grants, whether that is through individual contributions. We really rely on the support of our community to be able to serve our neighbors. One of the areas that is the greatest need for us outside of the truck, each neighbor who showers with us receives a brand new pair of socks, t-shirt, underwear. And so these are supplies that we would love for the community to continue to donate so that we can ensure that our neighbors not only have the hygiene access available, but they're able to have clean clothing after their showers.
Anything else that you want to add that I didn't ask?
I think one of the areas that is important to mention when it comes to funding and the policy changes, it's outside of that aspect. It also includes affordable housing, the increase in the market, on the housing market, and also some systematic areas that are still being addressed when it comes to the equity aspect, the ability for our neighbors to even seek housing who may have criminal backgrounds. So it's such a whirlwind of issues that continue to be at the front of our neighbors. And it's going to take, again, a community collaborative effort for us to be able to continue this fight for our neighbors.
All right. Thank you so much for the awareness here and for what you do. We appreciate it. Thank you.
Thank you.